Right. All right, so we're live. So today we're talking strictly about vaccinations and how that applies to us here in ARPS. And I think do you mind giving like kind of a rundown as to where we are as far as the community with the vaccinations so far with our clinics?
Sure. So, can everybody, is it working? Oh, good. I am muted. That's the good first step. Okay. So, right now, in terms of the community, have started phase 2, and we are in the first step of phase 2, which is those 75 and older. Governor Baker did announce that at the 4 mass vaccination sites around the state, that caregivers accompanying an elder over 75 to their appointment could be vaccinated as well. That was after they identified that there was a barrier to elders feeling like they could participate in those mass vaccination sites without someone obviously accompanying them for safety, and also because it can be very disorienting to be in such a big space. As of right now, in terms of our Amherst site locally, we've done over on Monday evening, it was over 2,500 vaccines. So I think we're um, probably about 2,800 right now. Um, so by the end of February, we will have done more than 3,500 if we're able to still get all those doses from the state. We now have a full complement of volunteers. We're onboarding staff to help support this effort, and we're just really excited to get it up and running and chug, chug, chug along so we can get as soon as we can to the next steps of the continued phases. There does continue to be a shortage of vaccine to the state of Massachusetts, which is unfortunately a barrier to us being able to move quickly to the next steps. But I know we're all working our hardest to get there. In terms of locally, we have 2 sites. We have our Amherst Regional High School site, and then our smaller site here at the Bang Center. The Amherst Regional site, we do it in the mornings and are out by afternoon, so that way athletics can still occur and we can get those air changes in the gym so that it's safe for our students and our coaches and other staff um, after our clinics end. And then here at the Bing Center, uh, unfortunately, we're not able to have as robust clinics here because of obviously our size constraints. Um, but we are still having those smaller clinics too as well.
Um, a question about that. Do you,
Yeah.
and you have a good handle on the number of vaccines that have been distributed. Do we know about what % of the way through people estimate to be over 70 or through?
Yeah, what I heard yesterday, which this has not been seen in a data point, but it's from a reliable source, is that they believe about 50% of those 75 and older have been vaccinated throughout the state as of this time.
Excellent. And is there a marker of percentage that we're going for before we open to the next
I would
group?
imagine so, but that's above my pay grade, unfortunately, and they're not sharing that. But I think it's a question that a lot of us are thinking about.
Okay.
Yeah.
Thank you.
Yeah, for sure.
And thank you so much for all of your hard work that has gone into arranging clinics and arranging volunteers and dealing with the uncertainty of numbers of vaccines that you're going to have from day to day and week to week, and really adjusting and being able to implement new plans on the fly. We are so grateful for your work in the county, in the community, that you've been able to give to us for helping us get people vaccinated here in Western Mass.
Yeah, it's only, I mean, I'm a small piece of it, but really it's the whole entire team, not just the town of Amherst, but really working with the school. Ben, I know I've worked with you and Rupert and Don, the amazing head custodian at the high school, and the other great team players there. Like it's really everybody coming together, and that's what I really love about this kind of activity is like you said, the volunteers. It's engaging our whole community in this effort and us coming together at this time to not just, I think it's that next wave of COVID response that's really touching to all of us, to kind of really directly affect others in our community.
Thanks, Emma. I've got a question. It was just announced this afternoon that their state is redirecting doses to some of the super vaccine centers in the eastern part of the state, redirecting from Western Mass. And I'm just wondering if you know how many, like the amount that they're redirecting, and how that's going to affect us.
Yeah, we're not sure. We haven't gotten confirmation of that. That's certainly a question that we're all thinking about. I know that Senator Comerford and Representative Dome have been advocating for us fiercely out here and our unique needs being in Western Mass. That individuals going to a mass vaccination site can mean a 2-hour round trip drive for a lot of our community members, which is certainly a barrier. So I don't have the answer to that. As we're on this meeting, I'm hearing emails ping into my email box, so that could be it. But as soon as we know, I'm sure we'll communicate that with everybody.
And is the state still receiving 86,000 doses?
Yeah, I heard anywhere from about 80 to 100,000.
Okay.
Mhm.
Trying to think. Krista, do you have anything else about number of doses?
Just curious about how it works if the state is. I need time to formulate that one before it comes out properly.
Okay.
It's the end of a very long day and a very long week.
Long week.
Go
how many
ahead, Jean,
doses does the state still have in the cold storage?
Oh, I don't know the answer to that.
But there are some that are being stored currently, correct? That are not have not been distributed or have not been earmarked for distribution.
I would imagine so, but I don't have the answer to that. I know the last time I had heard all of their distribution except for 5%, this was 2 weeks ago, had gone out to the end points. But that number certainly could be updated by now.
And I had a question about something I learned about today that I personally am excited about. But so today I was informed. Well, actually, yesterday I was informed, but I got confirmation today that veterans working in education will be getting kind of fast tracked to the like next week, fast tracked into the vaccination program. I was wondering if you had any information about that.
I don't. I think that's being coordinated on a federal level through the VA program.
Yeah.
In terms of the state involvement, I'm not sure we're a conduit to that, but I believe that's a VA initiative.
Yeah. And just in case there's any educators, paras, food service workers, I think I took care of our department today that are veterans. Make sure you contact, I guess Debbie Westmoreland is the one point of contact for us for now. So, and then the I guess the pressing question I have, which I'm not sure if it's an easy answer or if it's in the ballpark. This is the most common question I get is when are we anticipated to be up at bat, basically?
Yeah. They have not given us a clear picture. It all depends on vaccine availability and supply coming down to us for when we're able to move on to the next step. I do know that I heard that the town council supports teachers moving up, which is terrific. And I love that local advocacy for our teachers. Unfortunately, our site on the local level, we're not going to be able to be out of sync with the state distribution until we're given permission. But as soon as that happens, I know we really look forward to being able to vaccinate all of our teachers and staff as soon as we can.
And then a follow-up to, I'm sorry.
I just wanted to make sure that the community understands that it's not a decision that you make whether or not to change the phases and the steps. It's you're told by the state. And my understanding is that the state can revoke your ability to distribute vaccines if you don't follow the phases correctly. Is that
Absolutely. And that has happened to other sites that have decided to go out of step. Um, and I really want to be able to assure our community that we're going to be able to be a site for a long time and a continuous site right now.
And then the other question I had that's kind of pressing, that we've kind of discussed this a little bit in our private meetings at the Jlmc, is the start to finish. So there's been a lot of misconceptions, I think.
Mm.
You can educate me as to whether or not they're misconceptions, but start to finish, from first shot to last shot, about how long is that process?
Yeah, so it depends on what kind of vaccine you get. So for the Pfizer mRNA vaccine, it's 21 days. See, even I screw it up. Between those two vaccine dose appointments. With Moderna, they're 28 days apart. Certainly, if we move to the Johnson and Johnson or a different vaccine in the future, those are just one dose to be able to get your vaccine. But so far, the only ones that are approved by the FDA under their emergency use authorization are the Pfizer and the Moderna. And then what they are saying in terms of immunity is that it takes a minimum of around 2 weeks after you get that second dose, what we call the boost, for you to be able to have a good antibody response to have protection. And I know that the CDC, I forget if it was yesterday, all the days are blending together, but maybe it was 2 days ago, is coming out and supporting new language around guidelines regarding exposure for those that have completed their 2-dose regimen of the vaccine, where quarantine might not have to be indicated. With that being said, there are parameters to that. It would have to be equal to or more than 2 weeks after receiving the second dose of the vaccine, but still within 3 months of completing that vaccine. So it's not a forever thing. And also, certainly, if someone was to develop symptoms of COVID, they would have to be tested and go into quarantine for that. So
That
it's
time window is
complicated,
that time window is really interesting.
isn't
Okay.
it? Yeah, because
Yeah,
there's still so many unknowns. I think
right.
that's what's really interesting about right now, is that we're learning new things every day.
Hmm.
And certainly, as COVID is a RNA virus, they tend to create variants very quickly, similar to the flu, right? And all our strains for the flu. So we learn more every day with this for sure.
Excellent. I'm going to draw you back to a question about numbers and timelines and people. And so after this, people who are 75 and older are completed, the next group is 65 to 75. Do we have an indication in the state based on demographics of how big that group might be compared to the 75 plus group?
Yeah, I have not heard that number, but it's those 65 and over and with the 2+ comorbidities that people have to attest to. We don't need to see any medical records, but that would be if someone identifies as having hypertension and diabetes, or um, like pneumonia or asthma or obesity. Those would all be indicate the 2+ comorbidities that people could attest to. But in terms of population size, I'm not sure about those numbers, but I know that from what I've heard from the vaccine group that really has been going through these groups in terms of the phased rollout, that was considered.
And this goes to your question, or to what you were saying earlier about quarantine if vaccinated. So I understand there's an open question right now about whether or not people can transmit after vaccination. It looks like this advice from the CDC to not quarantine once vaccinated for that 2-week to 3-month window. It looks like they're looking toward finding an answer to that question. Is that a correct? Am I making that connection correctly in my brain right now?
That's how I process that as
Yeah.
well. But I know we're all still looking forward to clear language. On a state meeting that I was on this morning, while Massachusetts has not officially adopted those guidelines yet, um, state epidemiology, it's hopeful that Massachusetts will adopt those on a local level. So far, they have not, a state level. They haven't found an indicator why it would not be, but
Mhm.
we're just waiting for that official approval.
Okay. I guess another question about our local vaccination site. So we're happy that the high school is being used for this. We're curious if you can talk a little for the public who might not know what's going on. How does this work? How can a person get an appointment? What kind of process or procedure is there?
Yeah, so uh, our our vaccine appointments are posted on the Town of Amherst website on the COVID-19 page under vaccines. We do have rolling availability, which some people have experienced, like UMass, for instance. They have a great vaccine clinic that they're offering there at the campus center. Every once in a while, when the appointments get full, they say there's currently no appointments available. And that's the same with us too. And the reason is because we want to post vaccine appointments only if we have known availability, because we don't want to have people make appointments and then not be able to provide the deliverables, right? We want to be able to vaccinate people and have it be a joyous day. Um, so it's up on our website. You can also find us through the mass.gov COVID site on where to get a vaccine. They just updated the webpage today. So to be more user friendly, you can search by the zip code and we pop right up there. No longer just on that map right under UMass almost. So you're able to find it there. And then that'll lead you to our registration page and people can register for an appointment. It's a client-based system, so you put in your registration. You can use email for more than one person. If you had a family member that didn't have an email or a friend that you were going to help register or an elderly neighbor, and then you would click your appointment time for your appointment, and then you'll get a confirmation email about your appointment time. And then about 24 hours ahead of time, we send out a detailed message, like a pre appointment reminder with some instructions to our patients before their appointment. At the Amherst Regional site, we have some wheelchairs available. We have volunteer positions where I forget the specific name. Nancy Gilbert, my Board of Health chair, came up for the name, um, where I think it's patient transporter or something like that, where we help individuals get out of their cars. We've even had some volunteers do some valet a little bit so people didn't have to walk too far. So, really assist those with mobility issues. We had our first clinic last Wednesday at the high school. It was great. I think we had some lessons learned as well. We adapted our waiting line to be indoors, so those wouldn't have to be waiting outside for a period of time because certainly while we want to be able to socially distance and have those great air changes from those big HEPA filters that they got for the schools, we also want to be able to keep people warm and not hypothermic. So we adapted and overcame that so to make sure it was a safe site for our public.
Emma, I'm sure you're aware that there was a proposal from the State Firefighters Union teaming up with MassCon that was presented to the state Wednesday. There hasn't been a response yet from Governor Baker on it. And part of the proposal is to have firefighters and EMTs come into school districts directly to vaccinate educators with a pilot program for 20 high need communities. If this does get approved by the state, how would you see that working in Amherst?
Yeah, I think that's a great question. I haven't seen the pilot, so or heard of it. This is the first I'm hearing about it, Jean. So I think we would work alongside Chief Nelson in the school department to see how it could best fit our community.
I have no more questions about vaccines, believe it or not, other than just again to thank you for everything that you're doing, Emma. I don't think
Oh,
people realize the amount of work that you're doing, not only for our community, but some of the surrounding communities as
hmm.
well.
Yeah, that's great to point out because we are a Hampshire County site. Our primary communities that we're serving, Jean, are, let me see, I have to do it in alphabetical order to keep it. Amherst, Belchertown, Granby, Hadley, Hatfield, Pelham, South Hadley, and Ware are those communities that we're primarily serving. We've had a good number from throughout those different communities. And then we are starting to work with the local council on agings and boards of health for those different communities to see how we can address those that are homebound at this time. That's something that we're starting to think about and try to problem solve, especially with the delicate nature of the vaccine, as you can imagine. But we're really trying to meet our community where we're out, uh, where there are communities at, do outreach and adapt. Just like Krista said, things are changing all the time, and we're just really looking forward to coming together and getting through this current step that we're in and getting to all of you as soon as we can.
Yeah, I kind of wanted to echo that thing. So like, and especially I want to, just in case anyone who may be watching doesn't understand, like that, the first day was what, 600 people that cycled through
Mm,
the high school site.
yep.
I mean, it was okay from the outside looking in. It was absolutely seamless, and I think I don't know, the level of professionalism and I mean the level of caring even is just unparalleled. And I mean, I'm more than grateful for that. I personally got to see people that I knew from the community, and it was just great. Just the way it was all handled. I couldn't appreciate you anymore.
Thank you so much, Ben.
So I know I did hear Dr. Fauci say that April, he thought it might be what he called open season, I think he referred to, as far as what categories of people would be able to get the vaccine. How do you feel about that timeline here in Massachusetts, considering how low we are compared to
Yeah.
other states?
Yeah, I'm eager for the rollout to be increased. I know that that's something with our new administration on the federal level has been a priority, um, to really increase the speed and supply that we have available. I'm about to cough, sorry. So I don't I what I want to say is I hope that the space that we're in terms of a rollout and timeline, Gene, is just this moment in time where we've had a reduced availability of vaccine. I am so hopeful that with this new administration that the whole philosophy and rollout is improved, so that way we can really double down our efforts and exponentially increase our phase rollout at this time.
Who determines how many doses a state gets?
Yeah, I know that there's a federal committee that works on that. I'm not sure exactly who does that off the top of my head. I wasn't prepared to answer that question, but I know that the initial orders of vaccine were much smaller with the previous administration. Um, and then following inauguration, that ordering of, has totally been overhauled, and the vaccine plan. So we're learning more every day, and I'm we were told on the state level that February would be a tough month for vaccine availability. But hopefully they were really hoping it would just be a short timeline.
All right. Any parting thoughts from anybody? Thank you again, Emma.
Yeah,
Yes.
I love these meetings. I don't know about anybody else, but I have a lot of fun. And I just want to say how much I appreciate everything that everyone in this room and also our extended room is doing for our students and our community. We value you. You're noted in this tiring time, and take care of yourselves. Do that self-care. Keep on the good work. We're right on the edge of this, and together we're going to make it through as a community.
That's
Thank you.
perfect
Thank
punctuation there.
But I mean it. It's yeah, it's
That's-
good stuff.
Thank you. And thank you so much for all your hard work in helping move our community toward a safe place. So thank you.
Thank you.
Happy Friday, everyone.
Enjoy the long weekend.
Oh yes, yeah. All right.
Bye.
you.
Another
Take
victory.
care.
See you.